Welcome to another live session with me. We never wanted to miss out, even though it was the last day. We were just trying because there was some glitch. We were not able to air live. So, very sorry for keeping you waiting. Apart from that, welcome to Neethus Academy Reading. I am Vinod James. Welcome to another live session, the last live for this week. So, we'll all be seeing you after 2 days. So, although we kept you waiting for some time, very sorry for that inconvenience. Yeah, we were not able to come on time. Usually we try to keep it a bit time, but of course it's a technical glitch on the aspect where we were not really able to air with you keeping, with asking you to be on the waiting. Achunitin, good afternoon, a very good afternoon. So I hope all of you have not left thinking that we would not come to you. We know that you're all there with all love and affection. Anita Prabhu, good afternoon. Jyoti Janu, good afternoon. Dad Mohsin, good afternoon. After some time, Ambili Ajimon, good afternoon. Lydia Paul, good afternoon. Siminibu, good afternoon. Aishwarya, good afternoon. Milu Jitin, good afternoon. Rosmi George, good afternoon. A very, very, very good afternoon to all my lovely students. Saro Ranji, good afternoon. Neethu and Anish, good afternoon. Geetu Soni, good afternoon. If there is anyone who is attending the live for the very first time, please be kind enough to let me know that you're attending for the very first time. If not, no problem at all. But if you are, I would definitely want to know where you're from as well, if you could. Softy, good afternoon. Betsy, good afternoon. Shakila Bano, good afternoon. Saudi. Shalini Jibin, good afternoon. Tansi, good afternoon. Divya Devs, good afternoon. So, a very good morning, good afternoon, and a good evening to all my lovely students. Why? Because it's an international class that you're attending, because we have people from different parts of the world. To name the countries, a few. Of course, we have people from different parts of India, Nepal, Sri Lanka, Maldives, Mauritius, Malta, Israel, all parts of United Arab Emirates, and we have people from different parts of Africa, people from Australia, New Zealand, Ireland, England. We have people from Singapore, Malaysia, Philippines, Thailand, Indonesia, Pakistan, Afghanistan. So that's how diverse our class are. Desna, good afternoon. Betsy, second time. Fair enough, thank you. Kavita, good afternoon. Aishwarya, good afternoon. Anna, good afternoon. Simi, Suresh, good day. Good day to you. Asha Shibu, good afternoon. So I'm not going to keep you waiting for too long of a time, because I know that you've already waited. So if you have joined for the very first time, please do click the subscribe button of our channel. If you have not yet joined our Telegram pages, please do click please do join. If you have not yet joined our latest addition into our family, the WhatsApp channel, please do join that. All of them are free access for you, except the reading Telegram page. We have kept a scrutinizing policy. That's the only thing that we have kept. Apart from that, it's all free access for each one of you. We have just pinned the channels, so you can just join. Ramyanish, Beena, Sri Lakshmi, Ansu, good afternoon. Now, what are we going to do? We're going to do two things. One, we'll be talking about a part B. So the material will be shared on the screen. Abhiya, good afternoon. And as you can see on the screen, Neethu Madam will be coming live tonight, 10 p.m. Indian Standard Time, the very same page that you're watching. So please do clock in with a new writing depiction so that it can enhance your world of writing. Beena, good afternoon. Shirley, good afternoon. So the material will be popping up along with the timer, where you have a 2 minutes timer. Do the material as quickly as possible, and once you have done the material, just click saying that I have done, or put a thumbs up. That's all what I need. Okay, because I want to see how many of you are managing with the time. Okay, if you have any queries with regards to anything that Neethus Academy has in store for you, please do call the number. We'll be happy to assist you. So the material will be popping up on the screen. Just do the material as quickly as possible. Just find the answer. Don't type the answers. I'll ask you. There you have the material. Please do the material, and then we'll discuss. Right, as the time I've just alluded. I hope. I could see that a lot of you have said done. Achu was the first one to say done. Kavita done. Softy done. Jaya Arjunan. Good afternoon. This is the first time from Tiruvannamalai, Palakkad, is it? Good enough, good enough. Thank you, Jaya, for letting me know that you're here for the first time. Sri Lakshmi done. Dancy done. Shakila done. Maria Thomas done. Betsy done. Ramya done. Jyoti done, Vidya done, Abhaya done, Asha done, Rosmi done, Divya done, Simi done, Divya, Ansu done. Right, as you have all, not all, most of you have said, done. Now, would you be kind enough to tell me what is your answer and where you got that answer from? That where is very important. What is your answer? Yes, of course it is needed. Where you got that answer from? Tell me, where did you get that answer from? Sibi done, Shalini done, Geetu done, Shirley done, Swapna done. Okay, fair enough. Ambili done, right? Saro, C. Okay, fair enough. So the first answer I've got is C. Shakila, C from last para. Fair enough. Geetu Soni, C. Kavita, C. Okay. Softy, B. Asha Shibu, C from the whole para. Achunidin, C from the para. Vidya Sajin, C from the whole para. Neethu, C. Anita, C from last para. See, last para, no, there's only one para, no? Last part. Anita Prabhu, C. Swapna, C. Geetu, whole para. Simi, I got C, last part. Sri Lakshmi answer C. Tansi, C. Shalini, C. Rajimol, C. Ansu, C. Okay, whole para, last three lines, all those things. Aishwarya, C. Fair enough. So I only have a unanimous answer, is it? Only C, no, B was there. And I think somebody told me A. Not sure. Because I think I read somebody telling me A, no? Yeah, Divya was saying A. Fair enough. So A, B, C, all the three are there. Now let's see what is the answer. Yeah, Divya, I saw that. I'm very sorry I missed your thing. So now the question will be coming back on the screen. Now, what are the things that you have to be really cautious about doing? Part B. See, one, no keyword reference. Please do not refer the keywords because keywords will not give you the answer. You have to understand the gist of what it is. And each paragraph, each content of 6 different focus. So in this case, as you can see, what are the first thing that you do? One, read the question. As you're reading, underline the keywords in the question and understand the question. So that is very important and you have to relate it with the question. See, for example, it is very specifically saying it is notice and it is talking about. So something it is mentioning. So is it mentioning about the post-operative care, or is it talking about the functions of IV insulin, or is it talking about the insulin dosage? So now see, I've got my 3 options. Now, even the answer options you have to underline. See, there are 2 ways. You can read the answer option, underline the keywords in the answer option, then read in the passage, or read the paragraph and then pick an answer. Anything is fine. But reading the question, understanding the question, underlining the question is important. And the most appropriate method is called elimination method. Now see, post-operative care, that means after. Functions, then dosage. Now let's say IV insulin infusion. So they're talking about insulin infusion. Now patients that have required IV insulin infusions can be transitioned out to subcutaneous insulin once infusion rates are stable, glucose controlled, particularly if a diet has been initiated. So what is that? IV insulin infusion can be changed for certain reasons. So that is the entry to that. Now, because why? Now, why is the reason that they are going to change to subcutaneous insulin? Now, because IV insulin has a very short half-life, subcutaneous insulin should be administered prior to discontinuation of IV insulin. So they are saying this is important that you change to this. Now, when to change? Why the reason to change to subcutaneous and when to change? So it's all talking about when you're changing into it, okay? Now slightly, for me, it is talking about A. Now let's see. The basal infusion rate during fasting is a good predictor for basal subcutaneous insulin requirement. So now they are saying what is the sign in order to change to this. However, now they are coming up with provider often reduce the amount by 20% upon transition. Which one? The basal infusion rate to 20% upon transition. For instance, now if a patient required 1.5 units per hour of IV insulin overnight, this would suggest a basal need of approximately 36 units of insulin. However, reducing by 20% would result in starting basal dose of 30 units of insulin. Dosage. What do you mean by insulin dosage? The numbers. Okay. So they are mentioning, for instance, for example, or to explain it, they're just giving an example why this 20%. Okay. So the notice, that means the overall paragraph, it is not talking anything about functions of IV insulin, not there. Now insulin dosage, that is giving a reason how these 20%, if the patient needs 1.5 units, now what happened? Let's say it is about 36 units. Now if they have to reduce it, then it has to be 30. So it is not one particular thing. The answer is A. So I am so happy to say one person, that means Divya Subhash, is the only person who have got the right answer. So throughout the passage, it is talking about how to do that post-operative care from the patient that is required IV infusion to the post-operative care. Okay, now what are the things that you have to be? The reason of post-operative, why it is needed, when to do, how to do, and how this 20% can be achieved is being explained. So the answer to the question is not B, not the majority of the chunk of thought. Okay, you're referring keywords. Okay, insulin dosage is mentioned. No, see, they are giving you an entry saying that, for instance, how? However, providers often reduce the amount by 20% upon transition. For example, for instance, okay, just to make sure that how it is done. It's saying if the patient is requiring this one, then this much. If the patient 20, then this much. So throughout, it is not the insulin dosage. It is about post-operative care. Post, after. Understood? Good enough. So I could see that you have understood. 𝐴𝐻𝑢 is happy. Good enough. Even though, see, that's the beauty out of it, isn't it? Even though when one person, see, and what happens with that one person? That person had the courage to say in front of public, where all the others were saying different answers, Divya said, that is the answer. So this is what you have to start believing in your capability, and also to come out and say in a public platform where you have a number of students and going against the odds. It's an absolute stunner. Good enough. So keep on telling whatever you feel that it is your answer. You'll never know. Don't think that the majority is always right. If you think that is, yes, it is. But it should boost your confidence, saying that why I'm here with the purpose. The purpose was to show I have this as an answer. My perspective is this. So I got this. Fair enough. So good enough. I hope all of you understood. Any doubts? No doubts. Excellent. Because you don't have any doubts, I'm quite happy that you're enjoying, because we learn from mistakes, isn't it? Good enough. So that's the power of learning, and that's why we come on a daily basis. See, we know where our students would really look into. Their time is a pressure, and on top of that, you have to understand. See, you've been clearly told certain things. You are not utilizing it. Why? You're seeing it is Sarah Rainey, new name. Okay, hi. Now you said you don't have any doubt. Let's go into the next item. What is the next item? Riji, clear. Next, Anila Bhuvanendran, hi. Right. So let's go into the next one. What is the next one? Next one is part A. Anila Bhuvanendran, Princey, hi. brachial plexus injury. Very good. Divya, clear? Fair enough. Now, would you be kind enough to tell me some insights about the material? Because every time, why post-operative? Because everything is done for that reason, isn't it? The other two can be easily eliminated because it's not mentioned. I mean, it is not what you are talking about. The purpose is to show what are the things that should be done after. Okay, that's why it's post-operative. Anila Bhuvanendra in first class. Okay, thank you very much. Zera, first class. Fair enough. Anila, would you be kind enough to tell me where you're from? And Sarah, the same. Would you be kind enough to tell me where you're from? Softy is saying tricky material. Rosmi is saying easy material. Simi is saying tricky. Excellent. So it's a mix of tricky and easy, is it? Good enough. So happy to hear that all of you are there. I hope you understood, because the thing is, patients that have required IV insulin infusion can be transitioned. That means after. No? Anila Aluva. Okay, fair enough. Rajimul, it's okay now, clear. Fair enough, thank you. So you have to understand the gist about it. That's why I told you. Part B is about gist, not about keywords. So Anila is new, who's from Alua. How about Zara? Sarah, is it? Right. Even though not much of people have commented, but I know that you've been waiting. Zara, I'm working in Saudi. Fair enough. So another person from Saudi. Good enough. A lot of people are from Middle East. Good enough. Now, got the few insights whomever have told me. Now let's go and shoot the 20 answers. Okay, are you all ready with your answers to start saying tick, 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 whatever the score? I hope you're all there. Okay, and Ansu tricky material. Okay, fair enough. Shirley easy material. Okay, good enough, good enough. So now you have the material on the screen. How would you do part A? The part A, your material will be there only in front of you for 15 minutes. Okay, in that 15 minutes, you are expected to tackle 20 questions. Waiting, excellent, good enough, Vidya ready. So strategy in here is called skimming and scanning. Skimming means quick look, scanning means detailed look. Okay, so how much time can you take in order to do a quick look? See, skimming doesn't mean that you're going to read word by word. You're going to quick read it. Keith understood. Thank you. So how much time can you take to skim? 1 to 2 minutes is what they say, but I would definitely say take about 15 seconds per text, because you are going to have 4 texts which is based on one common theme. This is the standard thing. So 4 texts. You should, as you skim, you should be able to say, okay, text A is about this, text B is about this, text C is about it. It's just about practicing. You would be able to overcome such kind of thing in no time, because I'm sure that you all have the innate ability. The only thing is the lack of that intent, or that urge to do that in that stipulated period of time. You push yourself. You have to push yourself so that your talent has been shown out. So how to do skimming? Okay, I'm just going to do one part. So of course heading is important. Then brachial plexus is a nerve. There's an intertwined and controlled sensation to the arms and hand. A brachial plexus injury involves severe damage to the nerve, which is no pain, weakness, loss of feeling, movement, shoulder, arms or hand. Brachial plexus neck crosses your upper chest and your armpit. Injury to the network often happens with the arm forcibly pulled out or stretched of your head, forcibly pulled away from your shoulder. Mild brachial. So mild is an important keyword. May heal without treatment. So heal without treatment. But severe injuries require regain function. Our baby's experience plexus injury with uterus during delivery. The injury is called neonatal brachial NBPP. So you have just done that, isn't it? Now after this, you have to skim all the balance text. So here I'm just going to give you how to understand. Okay, see, it's here clearly saying common symptoms. So this text is going to show about a lot of symptoms, isn't it? So you can go through that. I'm not saying these are the only way, but you can go through that. Then, see here, X-rays, lots of tests are been. So anything with regards to the diagnostic testing method, and you can relate saying that, okay, it is there in C. Now D, of course, it is about a study, or it's a detailed flow chart on the aspect that's caused you to. Then they are giving you certain reasons and all. So study. So I understood what are the difference of each text. Now going into the types of questions. So 20 types of questions are divided into 3 types. So 3 types of question are there in that total 20 questions. This is just to add on to your mystery, isn't it? So they are saying what, but there is a purpose behind it. So question number 1 to 7, this has to be by hearted as of now, are called match the following question, where your answer should be anything between A, B, C, D, or you may use any of these letters more than once. Clear? So very straight. Now these are supposed to be by hearted because you're not going to waste your valuable time by reading this on the day of exam. Okay? Then strategy doesn't change, underlining keywords, because part A is purely keywords reference. Again, I'm reminding you, part A is purely keyword reference only. Now see, I'll show you why. If your skimming is proper, mark my words, you can easily find your answers. Easily find your answers, 1 to 7. Now I'll show you. The most reliable method to detect. So where are they talking about all these detect, test and all? So they're clearly saying it is only one place it is mentioned, isn't it? It is there in C. Now if you want to know which one is it, I can show you why. Because it clearly says what? It is the most reliable test detecting all those. So answer is C. Now, when do children are succumb to brachial plexus? Succumb means surrender, or they are prone to. So where are they talking about? It should be definitely there in A, isn't it? Children, where are they talking about? They're saying babies can experience when it occurs during pregnancy. So that is there. So the answer is A. Which evaluation technique? Again, evaluation technique. Do you really need a second thought about which is going to be your answer? No, I don't need. Why? All those techniques, evaluation methods, diagnostic methods are only mentioned in C. When should one pursue conservative management? So that is something which is there. So conservative management, it is clearly mentioned only in one place, isn't it? So continue conservative. So what? Pursue, continue. So the answer is D. This is why keyword reference are important, especially in A. Factors that often impose injury to brachial plexus. So what are the factors that can cause? Is there somewhere? So they are clearly giving you an end number of details on the aspect in text A, so where they're saying this can cause when your is forcibly pulled, then it can be due to regain function in your hand and all those things during delivery. So all those methods are mentioned in, or factors are mentioned in A. Now, next one. Condition that insists one to adopt early surgical exploration. What are the things that somebody needs an early surgical thing? So where are they talking about early? What are the conditions? If hematomas, pseudoaneurysm, yes, then you have to have surgical exploration. So the answer is D. Common indicators of brachial plexus injury noticed in newborns. So what are the injuries which are mentioned? So obviously symptoms, isn't it? Is there anything mentioned about babies there? Yes, newborn, symptoms of brachial surgery in newborn. So the answer is B. Understood why keywords are important? If your keywords are proper, your answers are easy to find. Now the next set of questions, these set of questions are called short answer question, where the instruction clearly says the answer can be a word, number, or numbers, or it can be both word and a number, or a short phrase. So please be aware of such kind of instructions, because this has to be by hearted by you, because you're not supposed to waste your valuable time reading the instruction. Now, strategy doesn't change. The question type changes, but the strategy doesn't change. Which regions might experience paralysis, signaling, and beginning of brachial plexus? So paralysis, is there anywhere which is saying paralysis? Yes, there is. Symptoms, signaling. So where is the paralysis happening? It is in arms or hand is the answer. Excellent. ARM, arm or hand. Excellent. I could see a lot of people have said 7 out of 7 and 6 out of 7. Good enough. I really missed it out. Yeah, sorry for that. Now, next question. The culminating point of brachial plexus, culminating, now where the point or where do they reach the final? So where are they talking about the final? So the brachial plexus begins from your neck, crosses the upper chest to your armpit. So where is the end? The end is in armpit. So the answer should be armpit. Clear? Now, question 10. An imaging technique utilized as a substitute for or in conjunction with CT scan. So something which has been used for instead or in connection, that means along with it. So which one? So there's only one thing which has been done, isn't it? What is the thing? MRI. Some providers may use MRI instead of or in addition to CT. So MRI is the safest bet. You don't have to write magnetic resonance imaging and all. Why? Because MRI, the abbreviation was already given. We have to manage time as well. Injuries incurred by a child during pregnancy, childbirth are referred to as what? So injuries, pregnancy, childbirth, somewhere in text there. Yes, this injury is called, see, the babies can experience brachial plexus. So injuries while in the uterus or during delivery, this injury is called neonatal brachial plexus palsy. Simplest one is NBPP. Good enough. Now next question. Which test? So test means go to where? Straight away go to C. 4 weeks post-injury identify signs of nerve degeneration. So 4 weeks post 4 weeks. So 3 to 4 weeks after, and all those things are there. So what is the exam? Your provider will likely to do a baseline electrodiagnostic exam 3 to 4 weeks after your injury. So the answer is electrodiagnostic exam. Okay, if you have written baseline electrodiagnostic, that's also okay. All right. Right. Next one. What's the recommended duration for conservative management before considering other options? So conservative management, I know that it is there in D somewhere. So recommended duration means time. Conservative management is there for 2 to 3 months. So the answer should be 2 to 3 months. Good enough. Which supplementary diagnostic procedure is to be taken if the nerve action potentially yields positive results? So positive, negative and all somewhere in here only. So nerve action potential positive. So the answer should be neurolysis, isn't it? NEUROLYSIS. Excellent. Now for the final stint, that's it. Last set of questions. These set of questions are called fill in the blanks question, where the instruction is as a word number, very similar to short answer question, but you always have to remember redundancy is something that you have to be very cautious about. You can't repeat the word already there in the question. It can be as simple as that of an article because it is fill in the blanks. You're only expected to write what is missing. Don't write everything. Okay. Strategy same. Children who have brachial plexus injury lack dash on the affected area. So where are they talking about all these? So children, symptoms, isn't it? So affected side, all those things. What are they saying? Absent. What is it? Moro reflex. Or you can start startled response. Anything is fine. But the safest one is Moro reflex. Good enough. Now, if clinical evaluation confirms pseudoaneurysm, then they have to be followed by earlier surgical exploration. So surgical, pseudo, everything is there in day. Now what is that? Early surgical, pseudoaneurysm is there. So what is the next thing only missing? Hematoma. Hematoma. Right. To rule out bone fractures associated with brachial plexus injury, X-ray are typically taken due to their dashed nature. So X-rays are taken due to their typical nature. So to rule out fractures and all those things, where are they talking about? It should be there somewhere in C. Why? Because that is where the test and all. Now, what are the things that you have to really look for? So you are likely to get an X-ray on your neck, shoulder, arm associated with bone fractures. Okay, the next keyword, especially since brachial plexal injury typically happens from traumatic injury. So what is the problem? The problem is because the injuries are traumatic. Okay, so the answer is traumatic. TRAUMATIC. We've just, if you really look into all the keywords are there, they've just interchanged everything. So you were really searching, because if you really search for the keyword, what are the keywords in the question? See the keywords in the question. X-ray is there, bone fracture is there, brachial plexus is there, because it happens from, because it is traumatic. That is why traumatic in nature. So traumatic injuries is not there. So because it is taken due to their traumatic nature. TRAUMATIC. Good enough. Now question 18. Brachial plexus is a network of dash, control movements and sensation to your arm and hand. It should be there somewhere in A. So it is the intertwined nerve. INTERTWINED, intertwined nerves. NERVES. Penultimate question for this week. Tests which include dash and nerve conduction studies, measure nerve conduction, muscle signals, which are electrodiagnostic exams. So of course you have all these keywords there in C only. So electrodiagnostic exam is there. Then what are the other things that is missing? It is clearly saying these tests, electrodiagnostic exams, are electromyograms. ELECTROMYOGRAMS is the answer. So the ultimate question for today, if no dash is achieved post to conservative management, then surgical exploration is ensued. Ensue is a very beautiful word which means follow. So where are they talking about? It should be definitely in. So conservative management is there. No is there. Surgical option is there. So what is the one which is missing? The recovery. RECOVERY. So I have wrapped my 20 answers. If you have any doubts, please be kind enough to clarify. If not, do shoot your total scores. What are your total scores? 17, Soumya. Good enough, good enough. Keep it up. Softy 16, good enough. Vidya 18, good enough. Shakila Banu 16, good enough. What are they? See, after some time, is it? Ambali Ajimon 18, Sri Lakshmi 17, good enough. Rasna 16, good enough. Neetha 16, good. Betsy 16, good. Rosmi 16, good enough. Swapna 17, good enough. Shirley 17. See, do not worry. 15, 16, 17, 18 and all are not bad. Why? We knew the material was a bit tricky. Ansu 18, good enough. 15th answer, could you explain? 15th answer is a very straight one, isn't it? Child who have this injury, lack, affected area, on the affected area. So what? They're only talking about moral reflex, because it is there on the signs, isn't it? What are they lacking? So signs. What are they there as signs? Signs should be there in symptoms. So symptoms, then go to refer the keyword where? Child. Children is there. So absent. Why? Symptoms of brachial plexy in newborn. So that is child. What is the symptom? In one side. On the affected side, it is moral reflex. Softy, Divya 16, Softy, thank you. Siminibu, thank you. Shakila, thank you. So as all of you have said, thank you. That means you don't have any further doubts. So it was a pleasure having all of you for 1 week with me. But do not forget that Neethu madam is going to come tonight on the very same page. So please do clock in. Do keep a reminder. We'll all be waiting for you there. Until and unless, I will see you next week. It's adios from me. God bless you all. Take care. Bye. Have a great weekend.